I welcome you to the Family Hour. We thank the Almighty God who has enabled us live today to see the beauty of this day and to see this evening. Thank you so much for choosing Church of Uganda Family TV. This is the Family Hour with me, Adrian Austin Mokalazin. Now, Family Hour, empowering families one episode at a time. Remember, our Tuesday is Family Health, where we discuss all matters concerning health. And this whole month, we are discussing cancer and palliative care. But just to remind you, in case you're joining us for the very first time, every Monday we have education and career. Tuesday is family health. Wednesday is family finances and wealth. Thursday, leadership and governance. And Friday is parenting. Now, this is our episode where we are discussing cancer. I want you to understand cancer, but also the role of palliative care, which is very, very important. Last week we discussed something about palliative care, but we realize we need a lot of more information and awareness when it comes to palliative care, because you and I can pass on this message, because we all need palliative care. Now, it is estimated that over 33,000 Ugandans are diagnosed with cancer every year. Now, this is an alarming number. 33,000 Ugandans. Now, only 7,400 can make it to the Uganda Cancer Institute. What about the others? That is a very big question. So, as we create awareness for one cancer, it is also important that we also see or look out through the ways in which we can minimize this number, because 33,000 is really a very big number. If this is the number that is diagnosed with cancer every year, and among these are both male and female, young and old. So there are even cancers that affect the young ones. There are cancers that affect the males and the females independently, but also we have cutting cancers that affect both male and female. Now, we are going to hear from the executive director of the Uganda Cancer Institute, because we know we see approximately 7,400 people make it to the Uganda Cancer Institute. So he's going to tell us what they do at the Uganda Cancer Institute, what happens at the Uganda Institute, what are the common cancers that are diagnosed at the Uganda Cancer Institute. But when we come back, we shall continue with our discussion with our guest in studio. Keep on Church of Uganda Family TV, Family Hour. Upper Mulago Hill Road is a very beautiful facility where a lot of things happen, but most of us might have heard about it but don't know what exactly happens when you enter into the gates of the Uganda Cancer Institute. Now, we are privileged to have Dr. Jackson Orem, who is the executive director of the Uganda Cancer Institute. And what are some of the things we expect from you? Of course, he'll tell us what happens when you enter into the gates of the Uganda Cancer Institute. Doctor, we are understanding what happens at the Uganda Cancer Institute, because you people who are here are at the heart of the cancer and the fight against cancer in Uganda. But you're most welcome.
Yeah. Thank you very much, Adrian. The Uganda Cancer Institute is an agency of the government of Uganda that is supposed to coordinate a comprehensive response to the fight against cancer in the country. As a background, the institute started way back in 1967 that was mainly looking at cancer in children. Because at that time there was a new cancer that was discovered in this part of the world that affects mainly children, but it was seen to be a very good model for research on cancer. So that is why the Uganda Cancer Institute was established as a collaboration between the government of Uganda, the National Cancer Institute of the United States, and then of course Makerere University was at the center of this collaboration. But of course fast forward, but yet there has not been a lot done in that area. Most of the areas where the concentration of government in health has been the traditional. Now the government has actually seen that cancer is a big problem, and that is why it has actually created or actually reinforced the mandates of the Uganda Cancer Institute. Yeah, so that is the background.
So when someone enters through the gates of the Uganda Cancer Institute, what should they expect? What do you work on when someone comes here?
The fact that you're coming to the Uganda Cancer Institute means that actually there's something that makes you think about cancer. It may be as a result of suspicion that maybe you could be having cancer. In that case, you are coming because you want to be investigated. But in most cases, people are coming because they are referred. We are actually the referral center for all cancer cases in the country. So when you come and you are referred, the first thing which is done is to confirm that indeed you have cancer. So a number of investigations are done to do that. And then once that confirmation has been done, then we plan to treat you depending on what we call the stage or the extent of the disease. Because first of all, each cancer type has its own treatment. And then of course also the different stages. If it is early stage or it is advanced stage, they are treated fairly differently. And in order for us to do that, we need to have a comprehensive team. That means we should have the doctors must be there, the laboratory people must be there, the nurses must be there, and name it, everyone actually working together towards making sure that the patient is treated effectively.
Wow. So what are some of the commonest types of cancers that you have registered all these 50 years you've been in service?
First of all, to start off, as I said, the institute started as a research facility for cancer in children. That means there are certain cancers that actually affect children. And of those, commonly we have what we call Burkitt's lymphoma, followed by Kaposi sarcoma, and then there is also the leukemias, and then kidney cancers. Those ones affect many children. And then of course in adults you can divide them into whether they are females or males. And in the females, of course, the most common cancer is cancer of the cervix, followed by cancer of the breast. And then there are also other cancers that relatively actually are fairly common in women, but can also affect both women and men, like cancer of the stomach, cancer of the esophagus, cancer of the liver, and then name it. And then in men, the most common cancer now that we see is prostate cancer. Prostate is a certain gland that sits below the urinary tract of a man, and usually it appears fairly in an advanced stage in our setting. That's simply because people are not coming early enough. Otherwise it can be effectively treated, and that is followed by Kaposi sarcoma, and then cancer of the stomach, cancer of the liver, and then the lymphomas. Those ones are fairly common in men.
So next time we shall find time and we come and get into the details of these cancers so that we create awareness, and then to also tell the people out there to always come before it is severe. But you talked about something that is so touching. You said that this is the only referral, the national referral center for all cancer cases. Now, is there any strategy by the government or by the Uganda Cancer Institute to create services or to extend cancer services to the people across all districts of Uganda, so that someone doesn't have to travel, for example, from Adjumani to Kampala, or someone doesn't have to travel from Kabale to Kampala, or from Nebbi to Kampala?
For a very long time, we have had only this facility here in Kampala. That means all cancer patients from the whole of the country, once they are diagnosed, they are actually supposed to be sent and then treated from Kampala. But that has its own drawback in the sense that there are other factors that can actually stand in the way of the patient coming over and getting treatment here. And then in addition to that, there are very few places where diagnosis can be made. So that means it excludes the majority of patients who could have benefited if those factors were addressed. And some of those factors are things like transport, where to stay, no relatives in Kampala, they don't have the money to feed themselves while they are in Kampala. So recently the government actually came up with another strategy. And this strategy is informed by the fact that it's not very cheap to establish cancer treatment facilities. It's very expensive. For instance, things like radiotherapy equipment, very, very expensive and complicated actually to set up. So the government came up with a midway strategy and said, look, why don't we set up what we call regional cancer centers? And the locations where these regional cancer centers were to be set has also been already identified, and some of them have already been set. So for the western part of the country, the center is in Mbarara. And then for the northern part of the country, it is in Gulu, and then eastern Mbale, and northwestern, which is a bit off, is going to be in Arua. So we are going to be starting in the current National Development Plan 3 with those centers. And of those, I'm happy to inform you that actually the center in Gulu is already established, is ready. Actually, it's just a matter of commissioning it. It will start now treating patients. And then the one in Mbale is already under construction. The one in Barara and Arua, we are hopeful that some funding is going to be got within this coming financial year, so that by next year we should have started their construction, so that by the end of the National Development Plan 3, we should have had all these regional cancer centers actually operational. Okay. The advantage that this is going to give is that now patients, say from Arua, they don't need to come all the way to Kampala for their treatment. But the other good thing is that whether you are in Arua, you are in Gulu, or you are in Barara, we are going to coordinate all these centers centrally. So that means actually the management of the patient in Arua, the management of the patient in Gulu, or in Mbale or Barara will be the same. And it is only those patients who have complications to manage in those centers, because they'll not be having all the facilities that are here at the center, that will be actually referred and managed from here. A case in point, radiotherapy. Right now we are going to be having only here in Kampala radiotherapy facilities. So that means patients whose cancer require treatment with radiotherapy will have to be referred here to Kampala to be treated. Okay. But in as far as follow-up, the routine follow-up of patients is concerned, once you are treated and you are sent back home, you can actually be followed up from those nearby regional cancer centers. So that is actually the strategy, operationalizing what we call a comprehensive national cancer control plan, which is actually I would call it the idea that will govern the way cancer is managed in the country, from trying to find out whether somebody has cancer or not. We call that detection, which must be done early, up to when somebody maybe now has very advanced cancer and all the treatment options have been tried, and there's not, I would not say not much that can be done. All the treatment options have been now offered, and what we can now only offer in the absence of an effective treatment is what we call palliation. Palliation is aimed at making sure that somebody in the first place is free from things like pain or symptoms, and then that person maximizes what else he or she can actually do in life that makes him happy. We call that quality of life.
We kind request that next time when we call upon you, you will even give us more and more time. But for now, I want us to end it at here. But what is your last message, especially to the people out there concerning cancer? Because our topic is understanding cancer and the role of palliative care. And I realize probably in your position when you speak, because you're now here and you see whatever happens, you see all these cases. Now at least someone has trust in your words. Please encourage them, especially when it comes to cancer.
Information can be attained by, in fact, what we call peer. That means meeting one another, talking about cancer and all that kind of thing. And in this regard, I want to encourage the public to attend the 4th Uganda Conference on Cancer and Palliative Care, which is being organized jointly by the UCI and PCAO, that is Palliative Care Association of Uganda, and it will be at the Speak Resort, Munyonyo, 14th and the 15th of September. This is where we will have peers reviewing themselves, and then also the public interacting with the experts in cancer and palliative care to understand more about the disease. So I really encourage the members of the public to attend this conference. So it is something which I encourage members to attend.
Those are the words from the Executive Director of the Uganda Cancer Institute, Dr. Jackson Orem. But with us is now a guest who is none other than Sarah Komugisha from Kawempe Home Care. She's the Manager, Medical Services. Sarah, you're most welcome.
Thank you so much.
We are delighted to have you this evening, by the way. We don't take it for granted. We really appreciate this time you've given in to come and add a brick onto this awareness campaign.
I'm grateful also to have this opportunity. And good evening, dear viewers. And I'm happy to be here and to work together with the Family TV. Thank you so much.
And now, talking about our topic, understanding cancer and the role of palliative care. Of course, we know that the ED has really tried to highlight some of the basics that people need to at least follow. And he has given us some hope that they are trying, as the Cancer Institute, to now to regionalize the services so that someone really doesn't have to all the time travel to Kampala for treatment, and that is really hope. So now we get back to you who offer the palliative care services, because now when the doctors have given their medical service, the patient is now in your hands. For instance, at Kawempe Home Care, what happens if a patient comes here, shows up with maybe cancer, and what kind of services, what kind of support do you offer to them?
Okay. On behalf of Kawempe Home Care, it is a community-based organization that deals with the patients who are having HIV, TB, and cancer. And it is a facility which deals with the patients. It's a daycare facility. We do not give 24 hours service. Yeah, so we don't admit patients. But we also have a hostel for children who are suffering from cancer from the age of 18 and below. And this idea came about because of many of these cancer patients were sleeping outside on the veranda at the Cancer Institute. And we realized that we can come up with an idea of these patients, providing them with accommodation so that they can get this treatment. First of all, the completion rate for the treatment, for the patients who are on treatment, was quite low. So you find that most of these patients come from very far up country. So when they come for treatment and they give them a short appointment, you realize that when they go, they don't return because they don't have transport to come back. Some of them are having different ideas about the cancer. Some of them are thinking they are bewitching them, and so they end up like not returning for treatment. So we provide accommodation for these children. We provide them with food and also transport. We ensure that we transport them from the facility to Mulago and pick them back to the facility for all those who are having their appointments, to keep their appointments. And sometimes these children get worse, maybe after their treatment. At the hostel, we have a nurse who takes care of them. We have actually a night nurse and also a day nurse to ensure that they monitor their conditions. When the condition worsens, then this patient is taken back to Mulago to ensure that he gets proper treatment. Yeah, but as far as the challenges...
Actually, before we even get to challenges, we are going to take a short commercial break. But when we return, there is still a lot we need to hear from Kawempe home care and perhaps the cost attached to these services. So stay with us as we take a commercial break. I welcome you back from the break. This is the Family Hour, and we are continuing with our topic, which is understanding cancer and the role of palliative care. So there is something so funny here, especially when it comes to some patients who deliberately choose to attack those who are helping them, to give them support. And they accuse them of causing the illness to them. But I know sometimes it is pain that makes them maybe utter all that. And we pray with them so that God can heal them. But the good thing is that there is palliative care, and there are stakeholders, there are organizations, associations that have come on board to offer this service. And before the break, just in case you're joining in, we had some of the palliative care services that are being, and support that are being offered by Kawempe Home Care. And with us is Sarah Komugisha, who is the manager medical services. And Sarah, before the break, you told us that there are challenges, and one of the reasons I was laughing about is because of some of the challenges where we see patients accusing those who are giving them palliative care, and partly because of this pain. But you, as someone who is exposed to the families and the patients, what are some of the challenges you can talk about, especially when it comes to palliative care service?
Yes, thank you so much. Just like I earlier on told you that these patients of ours go through a lot.
Yes. Right
from the facility and up to home where they are coming from or where they are living. You realize that maybe I'll start with the facility. At the facility, when these patients come, you realize there are very few facilities which are providing palliative care services, and also cancer as well. Though the government is trying its level best to ensure that these services are all over, to make sure that the patients don't travel a long distance to come and access these services. But while they're at the facility, at Mulago, for example, being the main cancer treatment center, you realize that the patients are usually very many patients. The cancer patients are many. There is no enough space for these patients. you realize that even the toilets alone can be very few, and yet there are very many. And they sometimes spend there the whole day because they don't know what to do, because they do not have anyone to navigate them through. Someone has come all the way from Koboko and is in Mulago. When it gets to Mulago, there are so many people around there who pretend to be like helping.
Yes.
And yet they are not helping.
They're
Can I help you, please? Can I help you? And then they maneuver around to just get money from these people. So the patients get confused where to go, where to start from, and so they end up, some of them going without getting treatment, or when they get it for the first time, then they may not return when they go back home. So they go through a lot. You realize that sometimes we have had complaints about patients being there and their records get lost. Yes, true. Someone returns for a visit and the file is not seen, and he has no one to help. So the patient keeps on waiting, has come from very far, has nowhere to sleep, and so they end up even like giving up. So Kawempe Home Care, just like I earlier on told you, that it has a hostel for children under 18 years to help these children access treatment in Mulago.
Okay.
We transport them to Mulago and return them to the facility, but the facility is very small. It accommodates only 30 children with one caretaker, which totals up to 60 patients. But sometimes we have gone up to 40 because the patients are many. The patients are many. So sometimes we are overwhelmed. The entry point for this service to get an accommodation in Kawempe Home Care, first of all, you have to be diagnosed with cancer at Mulago Institute, and so you will be referred from Mulago to have accommodation at Kawempe Home Care. Because you cannot.
It is Cancer Institute that refers.
Yes, that refers to us patients for accommodation. Because you cannot just come from up country and you come straight away for accommodation in Kawempe Home Care. No, that one is not possible, because they have to call us and find out if there is space, because usually we don't have space. So we also allow these children to create space for others who are having short appointments. When the children are given a long appointment, we allow them to go home. Say, for example, they were given an appointment of 2 months. So you give space, you go back home, and then you return after 2 months, so that we deal with the ones who are having short appointment, like 2 weeks, 1 week. Yeah. So, but Kawempe Home Care, in taking care of these children, depends on donations. We actually do not have a standard like where we get money to support these children. It is all about donations. Well wishers, they bring food for these children, clothes, and also support in any way financially to make sure that these children are having good life.
Is the hostel also located in Chevando?
Yes, the hostel is, together with the Kawempe Home Care, for those who have just joined us, it is located on Gayaza Road, opposite Kamwesi, and near Redeemed Church of God. That's where it is located. It's just a walkable distance from the main road to where the facility is. Yeah, it is nearby. So when we go back to the challenges, you realize that these patients also need navigation. Someone to navigate them. Even the patients we have at Kawempe Home Care, we have a navigator who ensures these patients get to Mulago and they are navigated through. Where are they? Who are they going to see? Which doctor after there? Where are they taking, getting treatment from? And to ensure that the patient is navigated around. Because Mulago is complicated. If you're new, you will get confused. And you will end up not getting treatment.
Sure.
So we have a navigator to ensure that this patient gets treatment. in a proper way, and we get a feedback in case this patient is admitted to ensure that we follow up with this patient. For the ones who go home for maybe they have a long appointment, we keep in touch with them to ensure that they keep their appointment, because some of them, when they reach there, they get confused. Others tell them to start taking some herbals, they will be fine, like that. So we follow them to ensure that they are not just on herbals, because we have not had any clear herbal treatment that is curing cancer. So they have to be on their treatment. So they also have poor social economic status, because some of these people were working and they stopped working, they lost a job, and now they are there. Maybe they were working here in Kampala, they end up like being bedridden, and they can no longer work, so they are not earning. So they cannot find accommodation, they cannot find food. So we have sometimes come in to provide some food if we have, but of course it is all donations, and then follow these patients in their communities. They get treatment from home to make sure that we control pain and also symptom management. Yes, and then there is also delayed initiation on treatment. Some people are put on chemotherapy, radiotherapy, and the lines are so long. And then you realize that they end up like you go there several times and you're in the line, but you're not getting treatment. But I really thank the Rotarians. By the way, I'm a Rotarian. Yes, I'm the Hope Creator President of the Rotary Club of Chireka Movers. And I'm running this year 2023-2024 as a president. And I'm really very happy that I was given this opportunity to talk about cancer, because even Rotary, we are supporting cancer. That's why you see we are having a cancer run. And it's coming up, by the way, on 27th. Let me hope you're also going to run.
I've always run.
Yeah, so this time around we are getting the kits through online. You register online and then you pay, and then you get the kit for running. So this is helping us to make sure that maybe the services are improved. Yes.
Now, talking about improving services, we know that the line ministry when it comes to palliative care is the Ministry of Health, and there is a department which is called Palliative Care and Hospice, and this department is in charge, directly in charge of palliative care and follow-ups. Now, this ministry is headed by Dr. Muwanga Moses, who is the Assistant Commissioner of Clinic Services in charge of palliative care and hospice. Let us listen to him as he tells us the role of the Ministry of Health when it comes to palliative care, and what the ministry is really doing to ensure that palliative care services are extended to up to the deepest village in society, and perhaps some of the challenges they are encountering, and then we shall be back. With us is now Dr. Moses Muwanga, who is the Assistant Commissioner in Clinical Services, in charge of palliative care in the Ministry of Health. And we are still understanding and digging deeper into the matters of palliative care and cancer. Doctor, I'll kindly request you to first greet our viewers.
Thank you so much. Good evening, viewers. I'm glad that I'm on this TV and I'm here to share with you what the role Ministry of Health plays. Ideally, palliative care is an approach where we improve the quality of life. Especially for the quality of life for the patients and the families of those people who are facing problems which are limiting their life. Some people have long illnesses, diseases which will not cure. We want at least to make their life better. For the little time they are going to stay on, We make the life of the patient better, as well as the life of the caretakers, because they're in depression, they know this person is going to die, this person has a lot of stress. So our role as palliative care, that's the role we play.
Okay.
Many people always misunderstand palliative care, thinking that palliative care is for the people who are going to die, people who have cancers, a chronic disease like hypertension, sickle cell. We have so many people who have sickle cell disease.
Yeah.
A person has cancer, a person has like diabetes. Diabetes is not that you're going to die immediately, but it's a disease you're going to live with all your life. So that person, the mere fact that you get a disease, palliative care comes in. Palliative care is a total holistic management, whereby psychology comes in, the social, the legal aspect, the medical comes in, and the physical. So the medical and the physical, initially they are much of it because they are giving drugs to this patient, but palliative care comes in to assure this person, to make this person understand his limiting illnesses. We are lucky that in the Ministry of Health, we have under clinical services, we have a division which handles palliative care, and that's the division I head. So I'm a commissioner in charge of palliative care in the entire country. So I'm supposed to overlook the entire country to ensure that all our health facilities, right away from the national, regional referrals, regional referral hospitals, to the lower facilities, that these palliative care services are there.
Okay.
So our role is to ensure that all our facilities in all the regions of our nation are offering palliative care. That is one. So ideally, we need to build capacity. Our Director General wrote a directive to all hospitals at least to have a cone of palliative care, because all our facilities have people with limiting illness.
Yeah.
They have diabetes, they have people with sickle cell. Ideally these days sickle cell is on the rise. So you find that these children, the mothers, the parents who have children who have these pains have to be assured. So palliative care comes in. The nurse has to be there to talk to the patient, to talk to the child, to give the medication. So that is one of the roles, to ensure that the facilities have. Then we need to build capacity. We need to ensure that human resource in all these institutions is there. Palliative care is a specialty which is done, and people have to take a course. We have certificates, we have bachelors, we have a master program, as well as a PhD in palliative care. So we encourage all our nurses to ensure that they go for these courses. So at various levels, right away from Health Center 4, Health Center 1, Health Center 2, Health Center 3, these are health centers within our parishes. When you come to the district, there's Health Center 4 and District Hospital or General Hospital. All these lower facilities should have palliative care. Regional referral hospitals, we have 18 of them in the entire country. The various regions have regional referral hospitals. They also have specialists. This is where we want people with masters and PhDs to be, so that the lower facilities can refer to them. Then on top, we have the national referral hospitals. Cancer Institute, almost the majority of its care, these are people with cancers, they need palliative care. Almost 60% of those people need palliative care within our Cancer Institute. Similarly, even the heart institutes, because a person with a heart disease always needs somebody to assure them, to assure the family, because they are spending a lot of money, they're in problems. So, and we train. And I'm happy to inform the community, as well as we have put positions for palliative care specialists in the lower facilities and the regional referral hospitals. So when you qualify as a nurse or as a doctor and you go and do an additional course, you can't be employed as a palliative care specialist in abroad. It's just giving them painkillers because the cancer is beyond. But if the person stays here with the family, he makes a will. Under palliative care, we also have a legal part.
Okay.
So that legal component helps people to make wills. Many people, when they are dying, they hate everybody around them and they change wills. So as palliative care, we come in, we guide these people to make a will and to accept that there is life and there is death. So they stay with their family, they have the happiest time with their family. So I think that one also helps in one way or another.
Yeah, true.
As palliative care. So we also make public awareness. We have international days, especially celebrated in October. The first Saturday of October, we always celebrate the World Palliative Care Day. And basically here we make awareness, telling people that there is palliative care, talking to them, feeding them, giving them words of hope makes it better.
Okay.
So that is what we do, though we still have a bit of challenges, but I think we are on the road.
Yeah, working on a lot. But like you talked about the services being extended, are there any plans by the ministry to make sure that these services can reach even someone in the remotest area?
Yeah, because as I told you,
Yes.
District Health Center 3s, those are parishes, then Health Center 1 and 2s at the village level. We have put in our structure in Health Center 3 and Health Center 4s. They are structures for nurses of palliative care.
Okay.
So we think that many people who have cancers, they are always sent down. So when they are sent down, the units which they utilize more are Health Center 3s, Health Center 4s below. Health Center 1 is more of a dispensary. We don't need a lot of staffs, but at this level we expect them to come back. So because we refer our patients down there, we hope that those staffs will do. And we have accredited many of those lower facilities to offer morphine. To an extent that nurses don't prescribe. But in Uganda, we passed an instrument allowing nurses to prescribe only morphine. Because in lower center 4s, Health Center 3s, Health Center 2s, they are not doctors. It's the nurse. So the nurse can give that drug. The areas which we don't have those services, I've told you that we do outreaches to those places. And we always work hand in hand with the private. I wouldn't say that the government can do it alone. We have a partnership with government, with private facilities, which we give morphine and we tell them they should give it free.
Okay.
So in an area where there's a private facility offering palliative care services, we don't want them to be much. We have public, we work with them.
Okay.
That is, then we also have outreach services. Yeah, but we still have those 40 districts, which we think these are hard to reach districts. You can't retain health workers. The facilities, you find that an area like Moroto, even movements of people, it's very risky. Our staffs, they move protected, so it becomes very difficult. Even the inmates themselves, they are here today with their cancer patients. The next day you go there, they are not there. They are nomadics. So those are some of the district areas which don't have palliative care services.
Okay.
But we are trying to ensure that we are there.
Okay. We want to thank you so much, Doctor. We believe it is really, really important that people know the role of palliative care, because from this discussion, realize that everyone needs palliative care, because you might not be a patient, but you have at least a patient, or someone is sick and you're directly attached to them. So we all need palliative care, and I believe this message is very important. Thank you so much, Doctor. Indeed, you and I need palliative care, and as soon as possible, the earlier the better. So after hearing from Dr. Muwanga, who is directly in touch or in charge of this department, Sarah, what do you think should be done to especially better the palliative care services that are being offered? And secondly, you who are on the ground, because now Dr. Muwanga is speaking at an authoritative level, but you're on the ground and you know what really needs to be done. What do you think can be done to improve the service?
Thank you so much. And my recommendations are that the Ministry of Education should ensure that more nurses, palliative care nurses, are trained and they are deployed in different facilities. We have a number of nurses being trained, but when they go in these other facilities up country, they are not given opportunity to do what they are supposed to do. Either there is no space, or the people they are working with don't understand. We have had instances where even some people named as morphine. Morphine,
Yes,
palliative care nurse moving around in the facility when he's talking about pain management and what, then they end up even calling them morphine, what, and so some people even end up like not doing what they are supposed to do. But we need more training of the palliative care nurses, and so if the government can give in some slots for government scholarships for some of the nurses, and also ensure that these nurses are deployed all over in all facilities to ensure that at least the patients can be managed there and can only maybe come for chemotherapy and radiotherapy in Mulago.
Okay.
But as far as pain is concerned, it can be controlled anywhere.
Okay.
So, and also I encourage the Ministry of Health to also ensure that these patients need home-based care. Home-based care is very, very important because some people want to die in their homes, not in the facility. But when they are in their homes, it is good for one to die without pain. At least you go peacefully. But every time you are in pain, even the caretakers also get stressed. So it is good to ensure that at least there is palliative care all over and home-based palliative care for all patients. Okay. And then lastly, we also need some people at the facilities to ensure that they navigate the patients so that the patients don't get confused.
True.
Yes.
That is actually very
Getting
important.
confused, they are here, they are there, they don't know what to do, their files are lost, and in actual sense they are not lost, but there are some people maybe who are just looking around to see what they can provide for them. And then sometimes they are asked for money, and yet these are very poor people. Someone has no money even to come for the treatment, and when they ask for money, they end up like just giving up.
Wow. Now, in a minute or less, Sarah, as we wind up this entire discussion, what are your parting shots, your closing remarks? And of course, I cannot deny you an opportunity to send out at least greetings to the people of Kawempe Home Care. Okay.
Thank you so much. I actually take this opportunity to thank all the people who have been watching us. It has been a very wonderful time, and we are looking forward to everyone participating in palliative care to ensure that the patients get the best services. And I also send greetings to Kawempe Home Care, the facility where I work with Dr. Guma Samuel. Thank you for being there for palliative care. Kawempe Home Care is a palliative care facility as well, provides community-based palliative care. And also, not forgetting my family, my husband, Jotham Kamanyire, Mr. Jotham Kamanyire, and all my children, Terry, Tony, Tricia, Miria, and Arnold, who is in Imbarara, and also my father, Mr. John Mugisha, and all my friends, Cassie, Janet, Diana, all of you, you're so much loved. Thank you so much. And also, I have my in-laws, Wilson. You're there watching. I've seen some clips you sharing with me, and thank you so much for watching. And all the Rotarians, Chireka movers, sparkle in the heart, please keep the spirit. Thank you.
We also thank you so much. You who has been watching us from where we started from up to now. I've worked with Brinko, Ategeka, and Didmas, Jonah Jal, of course, producer, and a very big team that we work together to see that you have family hour in the comfort of your living room. God bless you. We meet tomorrow. We are discussing family, finance, and wealth.